Okay, hi guys. So I have a 28-year-old female African American patient whose chief complaint is just right ankle pain. She was walking through the grocery store and she tripped on some wet water, and ever since then, her ankle has been bothering her. She has no past medical history, no surgical history that's important, and she hasn't got any diagnostic testing done. She is taking 800 milligram Advil right now. And she says that she lives on the third floor of the apartment with her roommate, and she does sometimes have a little pain when walking up those stairs. She says before this injury, she never had any problems. She was able to walk around, go up the stairs, and she likes to work out leisurely here and there. And so her goals for coming back out of therapy is for her to be able to continue to go to her apartment without any pain, walk around, exercise when she feels like it, and just be pain free in her activities of daily living. To start her warm up, I would just have her walk on the treadmill. This is just to create some blood flow and some movement down into her ankle. Her ankle is a little stiff, so this is just to get it warmed up, so we're just not going straight in there with exercise and strengthening stuff, just getting it loosened up first. I would have her walk on the treadmill 3 times a week at an intensity of 50% of her VO2 max. We would do this for 5 to 10 minutes at 60% of her max heart rate, and hopefully later progress this to 10 to 15 minutes warm up with a 60 to 70% VO2 max or a 70% max heart rate. This warm up can also help with her cardiovascular and endurance, especially since she says since her ankle pain, she hasn't been able to work out as much. So first, we're going to start with her stretches. And so because she's having pain in her ankle, we're going to start with her gastroc stretch, which is going to be standing. We're going to do 3 sets for 60 seconds. And a modification for it would be if it was hurting too bad to hold it for the full 60 seconds, we would just hold it for 3 sets of 30 seconds. So I'm going to have the patient stand up here. And I'm going to raise the bed. And because it's her right ankle, I'm gonna have her bring her right foot backwards. Your right foot back. Yep. And then you're gonna lean forward, keeping the heel of your ankle on the floor until you feel a stretch back here. And so I'm gonna palpate her gastroc to make sure that it's relaxing, because this is the muscle that we want to stretch. The reason that we're doing this is because it connects at the ankle, and a tight gastroc muscle can cause ankle pain. And so then you're gonna relax after she does 60 seconds, and then we would do it again. It shouldn't feel painful, it just should feel like a nice stretch. And again, her gastroc muscle is relaxed, and like I said before, we would do this for 3 sets of 60 seconds, but if she couldn't hold it for 60 seconds, then we would just do it for 30 seconds. So that's good for that. So the next stretch is, we're gonna work on her soleus muscle. I'm gonna lower the bed so she can get on it. And then she's gonna sit on the bed. Her right ankle, so what I'm gonna do is put this towel around, and then I want you to bend your knee to about 90 degrees, keeping your toes up. The reason that I'm having her bend her knee is because we want to relax that gastric muscle that we just stretched, and it crosses at the knee joint. So you're gonna pull your toes towards your body. Yep, and you should feel a stretch. And so I'm gonna palpate to see if I feel the soleus, which is underneath the gastroc muscle, and I should be able to feel it because the gastric muscle is now relaxed. We're gonna hold this stretch for 3 sets for 60 seconds and relax. We're gonna do it again. Hold it for 60 seconds. And if she wasn't able to hold it for 60 seconds, I would regress this just to a 3 sets of 30-second hold. Relax. So the next exercise I'm gonna do is ankle isometrics. I'm gonna come over here. and provide assistance for her. I'm gonna take off your shoe if that's okay. And so, for this exercise, we're doing to just do some stabilization and strengthening of her ankle muscles. And so first I'm gonna have her go into plantar flexion, and I don't want you to push me down. So a little bit more pressure, there you go. So she's not giving all of her strength, but she's not giving like too little strength. And so then you're gonna relax. So we're gonna do this one for 5 sets. We're gonna hold it for 10 seconds. So I'm gonna push you up into your toes, then you push against me. So this is facilitating plantar flexion. So I'm palpating the gastroc. I won't really be able to feel the soleus because the gastroc's not relaxed because it's out. But I'm palpating this to make sure that the gastroc and the soleus are contracting. They're relaxed for me. So push me down for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then relax. And again, if I wanted to regress this, I would do it for 3 sets of 5-second holds. And so the next muscle, I'm gonna put her down into plantar flexion, and I don't want you to push me up. So push a little bit harder. So I'm pushing you down, so don't let me push you down. There you go. And so now she's gonna hold that for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And while she's doing that, I'm palpating her tibialis anterior to make sure that that's contracting and that no other muscles are contracting. Again, I'm bringing her down. I'm pushing you down. Don't let me push you down. Good. All right, so now I'm gonna put her into inversion, which is her toes going in. Don't let me push you into inversion, so she's gonna be pushing me out into eversion. And for eversion, I will be palpating the tibialis brevis and longus. So I'm pushing, so don't let me push you inwards. Relax for me. Do it again for 10 seconds. Push a little bit more, there you go. And relax, good. And then for inversion, I'm gonna bring her foot out into eversion. I'm gonna put some pressure here. I'm gonna tell her not to let me push her out, and I'm gonna palpate the tibialis posterior muscle because that does inversion to make sure it's contracting. So push out for me, good. A little bit less, there you go, a little bit more. You're gonna hold that for 10 seconds, and then relax. And again, we would do all of those motions, 3 sets. We would do 5 sets of 10 seconds. If she wasn't able to do that, we would regress it to 3 sets of 5 seconds. Again, cueing the patient not to give all their strength when pushing, but not give too less for pushing. So next that we would do is ankle 4-way with resistance band. And so I'm gonna put the resistance band around her. You're gonna hold it for me. There you go. And so I'm gonna have you push down like you're pressing a gas pedal. Like you're pressing a gas pedal. So push against, there you go. And back up. You can press down again. Back up. And so she's gonna do 3 sets of 10 of these. Back up. And I'm gonna palpate again her gastroc soleus, and I can also palpate her tibialis tertius to make sure that they are contracting. She wants to make sure that she's just using the muscles at her ankles, and we would do 3 sets of 10 for these. And then if we needed to regress, we would go down to a yellow band because we're using a green right now, and we would do 3 sets of 8. Then relax for me. So now I'm gonna hold the band, and I want you to bring your toe up to your face as if you're pushing away from the gas pedal. Good. So back out. For this one, I am going to be palpating her tibialis anterior to make sure that's contracting, because that's what does dorsiflexion. For this one, I will make sure that I let her know, try not to contract her quad muscles or her knee muscles. So try to relax your quads and not pick your knee up off the table, and then just pull your ankle back a little bit, maybe a little bit softer. It's okay. And again, if she can't do this, then we will regress down to a yellow band. Good. All right, so now I'm gonna hold it in here, and she's gonna go into bringing your ankle inward, like this way. Same thing, she's gonna keep her leg still. I'm gonna palpate for her tibialis posterior. Going. It's a really deep muscle, so you want them to be relaxed so that you can feel, but I feel it contracting. 3 sets of 10 with the green band. Again, if she needs to regress it, she will go down to 3 sets of 8 with the yellow band. And then the last one for this one, I have her do it herself, holding it here. This time she's bringing her ankle outwards towards me. Good. And then I will be palpating the tibialis brevis and longus. Again, cueing that she's not doing any movement at her knee, that this is all being done at the ankle. Good. And again, that will be that we're doing 3 sets of 10 with a green band. If it needs to be regressed, we would go down to 3 sets of 8 with a yellow band. So next, I'm gonna have her sit at the edge of the table. So you're gonna come sit at the edge of the table. I understand safety, she would normally have a gait belt on. I'm gonna bring her down. So this time we're gonna do ankle ABCs, which are for active range of motion. If I didn't say, the ankle 4-way is gonna be a resistance exercise, and the isometrics are for, it's an isometric exercise, and then the first 2 things were stretches. So now we're gonna do ankle ABCs for active range of motion. And so what I'm gonna have her do is stabilizing her knee and her leg. I want her to draw the ABCs with her ankle. Good. I should be feeling all of the muscles contract, but really what we want is for the movement of the joint, because like I said, we want more range of motion, like mobility, which is usually more in the joints, not flexibility, which is mostly in your muscles. And I would have her do these alphabets 3 times. But if this was too hard for her, I would have her sit back up. And so, because that position, gravity is kind of weighing down on her ankle, and then I would have her do, bend this knee for me, there we go. And I would have her do her ABCs right here, good. And cueing her to try to keep her shin bone and her leg still, and only moving her ankle. And when we're doing also regressing, I will only have her go through the alphabet twice instead of 3 times. All right, and then her last exercise is gonna be step up. So we're gonna put your shoe back on. And we're doing these because we're trying to imitate her walking up the stairs. Sorry, it's okay, I moved too fast. So I'm gonna show her this exercise first. This exercise, we're gonna do a progressive resistance, and she's going to be holding weights because she said to me before that, you know, she has to carry her groceries upstairs. They don't have an elevator, and so she will have 2.5 pound weights. We would do 3 sets of 10 first, and she will come up with her right ankle, making sure that her core is tight, and then she will come up like this and then back down. You don't want your knee going too far over your toe. You want to keep your core straight, and then you don't want to push off of your left leg. So I'm going to give her the weights. You're going to step up with your right foot, keeping your core tight, not pushing off that back leg, and then coming straight up, and then stepping back with your left leg, and then back down. And this time I'm gonna be palpating because she should be using her quad muscles and her glutes when she extends, and then a little bit of her hamstrings when she comes down. So step up again for me. I'm feeling for her glutes and quads, and then hamstrings when she comes down. I'm also feeling for her core to make sure that her TA is activated and protecting her back, in which it is. And again, we would do, this is gonna be a progressive resistance exercise. So we're gonna do 3 sets of 10 first with 2.5 pounds for 5 pounds total. And then we would do 3 sets of 10 with 8 pounds, and then 3 sets of 10 with 10 pounds. To regress this, I would do 3 sets of 10 with 2 pounds, then 3 sets of 10 with 5 pounds, and then 3 sets of 10s with 8 pounds. And those are all her exercises. Thank you.